we do not have long-term outcome data for patients who undergo surgical changes. Now, fortunately, in modern science today, we have the benefit of an incredible amount of research that is now at our fingertips that allows us to understand these genetic conditions more, the transcription of DNA, all of the apparatus that is involved in cellular metabolism. And this is an awesome place to be. One of the things that we have learned that you probably haven't heard about is that healthy baby boys have an androgen surge from the time of birth up to about 3 months. So androgens, those are hormones that will virilize or make the child further develop as a boy and ultimately as a man. But the important thing to know is that there are cognitive changes and neurologic hardwiring that takes place during that time period of this androgen surge that leads that child to play and have behaviors of play that are unique to boys. This was published in 2015, came out of the Department of Pediatrics in Cambridge in the journal Hormone Behavior. But we don't hear much about that. So your mind, or your brain, I should say, is hardwired genetically at conception, but also very early after birth. All of those changes are made more permanently embedded in the structure and the neurologic connections of your brain. So here are a few other things that maybe you didn't know. So in differences of sex development, the long-term surgical outcomes, if a patient has surgery, those outcomes are completely unknown. So we don't know how some of these people will do over time into adulthood and later in life. And I would argue that as a result of that, we really should not be performing surgical changes except in rare circumstances and when only properly indicated, but certainly not for people that are biologically normal but are choosing to change their gender identity later because of an ideology that is pushing them to do so. And I say that with compassion because I understand that there are many complex reasons why a person might be moving in the direction of a gender transition or having a different gender identity. So I get that, but I just want to make the point that I think we just have to be very careful because we do not have long-term outcome data for patients who undergo surgical changes. We just don't, no matter what you might hear in the culture or in the media or even coming out of the healthcare establishment. We just do not. In fact, Germany has banned irreversible surgeries without informed consent. And that's because of high complication rates and poor outcomes in terms of sexual function, as well as urinary problems. There's sometimes very complex repair that gets done to the pelvic floor, complicated surgeries. And we don't know how these people do. And sometimes or often we see that these patients really do poorly with a lot of complications. But notice that it's not really even possible to provide informed consent to a procedure such as this. And the reason is that giving consent means that you understand the risks and the benefits and that you've weighed those things and you're making a decision one way or the other. But without knowing the outcome data or how people do over time, it's really impossible to provide that type of consent in the first place.